Aloha, I'm Dr. Taketa-Wong. Today's event is about autism and the nervous system, which consists of both the brain and the nerves. It's somewhat detailed, so if you stick with it, you'll be getting a wealth of great knowledge about autism. The nervous system controls both our voluntary and involuntary movements, like our breathing, heartbeat, digestion, and so on. In autism, there are many symptoms that can be connected to dysfunction in the nervous system. I want to emphasize that behavioral, occupational, and speech therapy can be critical aspects of a child's treatment. This isn't an either or. At the same time, it's important to remember that the majority of children with autism have several medical conditions underlying their behavior. So we're going to talk about a few of them. Brain inflammation. Normal inflammation is vital to maintaining good health. It's how we fight off infections. So inflammation, like fire, is important. Fire keeps us warm, cooks our food, and has been known to toast our marshmallows. But when fire gets out of control, it can damage or destroy trees, hillsides, forests, buildings, and even whole towns. That's the kind of inflammation that is commonly found in children with autism. In autism, inflammation can be caused by brain antibodies, exposure to toxins, and immune system issues. Problems with the immune system can be due to certain genetic mutations or other problems, and there can be a snowball effect where the inflammation runs out of control. When children with autism have excessive inflammation in their brain, it affects the brain's ability to function normally. So actually, the condition can affect adults as well, as in Alzheimer's, Parkinson's, and seizures. Again, my specialty is helping autism medically. For treatment of brain inflammation, I will typically use natural medicine remedies like peptides and antioxidants. If the inflammation is from toxins, I determine the most effective protocol to help remove them from the body and work with the family to manage the process. Brain antibodies. 62 to 75% of children with autism have antibodies that attack their own brain. An antibody is a protein that our immune system makes that is supposed to attack the things that make us sick, like viruses or bacteria. However, some of these children are making antibodies, again, that attack their own body. One is called folate receptor antibodies, which blocks folate from getting into the brain. And folate, as many of you know, is a vitamin that is critical for brain development. One course of treatment is having the parents remove dairy products from their child's diet. Removing dairy from the body decreases the amount of folate receptor antibodies that are attacking the brain. I also prescribe certain vitamins, CoQ10, peptides, and other natural medicines in order to further reduce the inflammation. I want to share a story that illustrates the mind-body connection and shows the difference that medical treatment makes when it comes to autism and special needs. I recently treated a 9-year-old patient with autism who had serious aggressive behavior and seizures. After careful diagnosis, I treated the seizures medically, and soon his aggressive behavior improved. Why? Because the seizures were making him feel terrible. Since he was largely non-speaking, he would act out, sometimes aggressively, towards the people around him. The behavior was clearly linked to his physical condition and needed to be treated medically. In a moment, I'll be explaining the 3 other medical conditions that underlie autism symptoms. But first, I find that some people do call and talk with me after viewing a video or 2 or visiting our website, and many choose to become patients. You are welcome to schedule a no-charge phone consultation with me. Our phone number and other contact information is on our Facebook page. I also encourage you to visit the online supplement store I founded as a fundraiser for special needs children. All the vitamins, herbs, and supplements are tested for purity by independent labs. There is a 20% discount, and our store is the only one where all net proceeds go towards helping special needs families with the cost of their child's treatment. The store is on our website at drtaketa-wong.com. That's Dr. Taketa-Wong, one word. Apraxia. Another nervous system condition that affects children with autism is apraxia, which is like signal interference, where the body doesn't respond to the brain's instructions. A common example is what happens in certain kinds of stroke, where the person tells their arm to move, but then it won't move. So, of course, with stroke, the symptoms are treated medically with drugs as well as specific movement therapy. Children with autism don't have the sudden, severe symptoms of a stroke, but they often have some difficulty in areas like speech. They want to say certain words, but their mouth doesn't move in the right way to make that sound. Apraxia of speech affects up to 65% of children with autism. That's what can make it hard to understand their words. Apraxia can also affect their ability to use inflection, which may cause them to sound awkward or robotic. So the child gets told, "I told you to pick up the book and set it on the table." When they don't, people often think that they don't understand or they're just being stubborn or defiant. Someone with a stroke isn't treated that way, but with autism, the child might be thought of as ignorant or accused of disobedience and in need of behavior modification. This is yet another example of the mind-body connection. So I will prescribe remedies to decrease brain inflammation and nutrients to support brain function. Neurofeedback, occupational therapy, and speech therapy can be very helpful in treating apraxia. Seizures. Seizures can be rare, occasional, or chronic. They can last anywhere from a few seconds to a few minutes. A seizure is abnormal electrical activity of the brain. The common image of seizures is people falling down and shaking. But there are other types that are not dramatic at all. A child may sometimes have a seizure when they get a high fever. That can be a normal response. But on the other hand, there is epilepsy, which is when there are recurrent seizures. Studies have estimated that 26 to 38% of children with autism have epilepsy versus just 1% in the general population. Another type is called absence seizures, where someone has a staring spell. People sometimes think a child is simply not responding or ignoring them, but it could actually be an absence seizure. One way to tell is to pinch the child. If they respond to that slight pain, then it is likely not a seizure. But if they don't respond to that pain, it probably is a seizure. Research has also found that a significant number of children with autism have chronic seizure-like brainwaves. What came out of that research reinforces the mind-body connection. When children were treated with anti-seizure medication, their autism symptoms improved. For seizures, I typically prescribe changes in food, the use of CBD oil, medical marijuana, Chinese herbs, neurofeedback, and anti-seizure medications. Please remember, the majority of individuals with autism have physical, medical problems underlying their behavior. Sensory processing disorders. This refers to the input we get from our sensory organs, from sight, smell, sound, touch, and taste. With autism, the sensory organs are normal, but the way the brain interprets the input isn't. So, children with autism often have either oversensitive or undersensitive responses to the input. So, for example, some children can't stand it if someone tries to cut their hair or their nails, or even just touch their head. And it can sometimes trigger an hour-long tantrum. Exaggerated responses can also happen with flashing lights, certain smells, and certain sounds. For some children, the sensory input is actually painful for them, yet other children might step on a tack and not feel any pain. There can also be issues with textures, which can affect how children respond to certain foods. For example, some may only want to eat crunchy food, while others may prefer only soft foods. These disorders are often related to brain inflammation, so I use remedies to decrease that and also prescribe nutrients that support brain function. I've also found Qigong massage helpful for sensory processing issues. As an additional note, with the conditions we mentioned, a child may also suffer from headaches, which can also affect their behavior. The last medical issue we're going to talk about is sleep. There can be many reasons for sleep problems, some of them nervous system related. There are two basic states for the nervous system: fight or flight and rest and digest. Many children with autism are in a constant fight or flight mode and have trouble staying asleep or falling asleep or both. I will typically use Lab tests, like the ones that determine the levels of different brain chemicals to help identify which neurotransmitters need to be addressed to help them sleep. In addition, I will prescribe certain nutrients that help to regulate brain function. In addition, sometimes sleep problems are related to seizures, so anti-seizure medication can help with sleep in those instances. I trust our discussion about treating autism medically has been useful for you. You're welcome to talk with me personally about any health concerns that you may have so that you too can be empowered with your health. All the contact information is on our Facebook page. Please remember to visit our online supplement store, which is on our website at drtaketa-wong.com. Our prices are very competitive, and all net proceeds go to helping children with special needs with their medical treatment. A link is in the post with this video. Mahalo, and I look forward to seeing you in 2 weeks. Aloha.